Welcome everybody to the April John Patriot monthly meeting, and it's good to see all of you. Lyle's going to come up and speak. He's our president. Can somebody play Hail to the Chief for us? And he's going to talk about the Who's Power Grab.
Ed. Patriot.
Yes. Oh, okay. Yes. Don't forget Lois. Okay. There's a fishbowl back there. If you can help her with the videos financially, that would be awesome. She spends a lot of time doing that, and you can go, Lyle.
I'm just going to lead it off with the.
You can start the ball rolling anyway.
Thank you.
Yeah. Don't be bashful when it comes to that. She does a good job.
Isn't it nice to have spring, by the way? Isn't it nice? How many of you have been out in the garden already? Yeah, oh, you can't wait, I tell you. I haven't, so there you go. Lyle, take it over, would you?
Okay. I actually have two articles that I'm going to cover this evening. One of them is from the John Birch Bulletin, and the other one is actually from the New American. I was going to make notes and talk about the notes, but after going through both of these articles, the author of the two articles actually condensed it down so it wasn't a book, but there's not too much you can take from it. And this is from the April Bulletin from John Birch, and it goes to say that the New American reported that this is a legally binding pandemic agreement that would empower the UN's World Health Organization to shape national policies concerning pandemic prevention, preparedness, and response, and referring to World Health Organization taking over many countries and managing pandemics. So with that said, how many pandemics could we look forward to?
Exactly.
Yeah.
It's just announced.
Right. In January 2021, PBS reported a World Health Organization representative appeared in China on Chinese state television in the early days of the pandemic. He praised the sheer speed of the response in China, saying, "We can see that there is no clear evidence of sustained human-to-human transmission." That was in the beginning of the pandemic. And then we saw even in a rural area like Wyoming how fast it spread from human to human. So they weren't telling us the truth at that time. Why in the world would anyone want to allow an international organization that early on had praised China's handling of COVID-19 to have it a hand in American prevention, preparedness, and response to next pandemic, planned or unplanned? So, the better question is, why would anyone trust the World Health Organization after experiencing its detrimental effects and related propaganda during COVID? And the best question is, where in the U.S. Constitution is this allowed?
Nowhere.
Nowhere.
Wow.
The U.S. Constitution defines the powers of the federal government, and anything not defined is left up to the states. So we probably should be getting together as Wyoming citizens and getting with our U.S. lawmakers, and I wouldn't say hammering them, but making them aware that we're aware of our Constitution and that the U.S. government has no constitutional right to do this to us. So what can happen in a situation like this where the World Health Organization gets involved in something like this? You have to understand, even on a local basis, where you have doctors, hospitals, and clinics that are administering health care. And if you, last night as an example, Marlis and I were watching Hallmark movie.
Oh, lovely.
Yeah, I sat there and held her hand and watched the Hallmark movie, and there were four prescription drug commercials during that movie. Okay, all four of the drug ads said that these particular drugs could cause sudden death, cancer, Parkinson's, Crohn's, all kinds of different disorders. And I looked at Marlis and I said, gee, I gotta hand me some of that. Why in the world?
Did you cry from the movie or from the commercials?
Both. Actually, I got fired up over the commercials. So, on a local basis, we have doctors should know something about these prescription drugs and knowing what they can do to us, and they're prescribing these, and we're taking them, no questions asked. And we're about to give the World Health Organization permission to control our health. Give me a break. Yes.
I don't know, I'm a naturalist and a holistic healer for myself. And I don't know if anybody knows what WHO and CDC is doing to people through the internet, through shutting them down. Those who use alternative methods that have been around for thousands of years for healing and treating. They are shutting them down, they are shutting them up, they are canceling them.
That just happens to be my next comment. Yeah, I've got a note here. It says, talk about finding a naturopath doctor who has a doctorate degree in holistic medicine. People, you've got to do that. You've got to go out and find a naturalist. I don't think the nearest one is probably Montana, is as close as you're going to get. North Dakota has them, Montana has them, and Idaho does too, but I'm not sure there's one in Wyoming. But if you're going to get well with something, you've got to start taking care of me, because the person that takes care of me the best is me. And you said, what is it, the CDC and what organization? World Health.
And other government officials
Yeah.
are shutting them down.
They're shutting them down, and when you speak the truth, they shut them down.
The essential oil is cedar wood. The CDC is trying to get it restricted so we can no longer purchase it. Cedar wood is good for so many things.
Mhm.
They're coming after us with all barrels.
Well, what you're talking about is common sense stuff.
Mm-hmm.
As an example, back in the early 80s, somebody invented plastic lawn chairs. And they said they would last 50 years. They didn't last 50 years. But that wooden chair that God made is still here on the patio. I got to remind you, God made is much better than man made. Because God is a multitasker. So with that said, if we're going to empower the World Health Organization to decide on a country-by-country basis on what we're going to have for health issues, and we've got some hinting of population control. We've got some hinting of what type of health care we have available. And when Affordable Care Act came about, I withdrew all of my licenses or contracts with all health insurance companies. I no longer sell health insurance. I refer people to organizations like Christian Healthcare. Because health insurance companies come with a $10,000 deductible. They have a co-insurance. This procedure is not covered. On and on and on and on. About 6 years ago, my father-in-law actually was diagnosed with congestive heart failure. And the cardiologist told him, while I was in the room with him, that he would have to live with that for the rest of his life. And I said to the cardiologist, I disagree. I had already talked to a naturalist in Montana about it. And he said, we can take care of that in about 6 weeks. And the cardiologist said, well, I've got credentials. And I said, that's fine, that means you're certified, but that doesn't mean you're qualified. So he took me back to his office and showed me his credentials. And I took my father-in-law out, and we got with the individual in Montana, and in 6 weeks, he no longer had congestive heart failure. So people, you have got to decide how you're going to manage your health care. And you're going to have to get smart about it, because if these people continue to do what they want to do with us, they're going to tell us, well, I'm just going to go on and read this. These questions are easily brushed aside by those who view American government system as a hurdle to be circumvented, destroyed, and rebuilt into a cog of global government. Remember, they are involved in a revolution. Marx and Engels penned their Communist Manifesto in 1848. Nearly 100 years later, the infrastructure for global government began to be built with the founding of the nefarious United States. Nearly 100 years after the manifesto was printed, the World Health Organization was established. Its website claims it is dedicated to global health and safety. It also says the organization connects nations, partners, and communities to promote health and serve the vulnerable. World Health Organization works with member states to achieve the highest level of health and for all people by pursuing universal health coverage. Okay, so let's talk about universal health coverage. What does that mean to us? Anybody know?
Control.
It's called control, that's correct. So what happens in universal health control? They decide who gets it and who doesn't. And it's nothing personal.
Personal
It's-
to me,
Pardon?
it's personal to me.
It's personal to you,
Yes.
but you're a number. See, I stand on the fact that our health decisions should be made by me. My health decisions should be made by me. And there's more answers out there than mainstream pharmaceutical research. So, pharmaceutical companies, they spend $30 million to get a drug approved. And then it causes cancer, it causes heart disease, it causes sudden death, it causes Parkinson's. But they spent $30 million getting it approved, and the FDA says, well, that's okay. The overall good is better than what it can cause. This is what's going on.
Right.
And we want to give our health care to the World Health Organization.
No.
We're in a really sad state of affairs, but yes.
You just said in the beginning that they praised the leader of the World Health Organization, praised Communist China for the way that they handled the pandemic in the beginning. And to my knowledge, they were welding doors shut. The paperwork for this is intentionally vague so that they can take more power. And that is a quote from the guy with the bow tie from John Birch, the attorney.
Yeah, the attorney.
Yeah. And so, you know, this is what they're going to do if they sign this. It's supposed to be a treaty, but it's not a treaty. They've avoided that because they have to have the legislature's approval for that. So they're doing an end around with this. And what they're going to do is what we see them do in China with the cameras. They're going to have carte blanche to install the cameras and to do exactly what China did. And I think they will take advantage of that.
Right.
That's what I'm thinking.
So how do we stop it?
So how do we stop it? We have a state legislature given the right kinds of power and influence in the state legislature. And we obviously, there was some reprimand from U.S. lawmakers about state legislator getting involved in, or no, I guess Congress people getting involved in state business, is that right? Is that okay?
We had a bill this year, it was brought by Jeanette Ward from Casper, that said that we would not follow the CDC or the World Health Organization, and we would not use their dictates to determine how we would do healthcare or deal with the pandemic in Wyoming. That failed on, I believe, a 26 to 36 vote.
But then, John, that's based on states' rights. Yeah, states' rights. So what we need to do is give the people in the state legislature attaboys and attagirls for what they're doing and make them feel good about what they're doing, and that we're on their side. And then with people like John Barrasso, Cynthia Lummis, and Harriet Hageman, get a hold of them in numbers. And remember, and I haven't heard from Ben Decker, I got to find him. But we want to put together that power of 500. So we've got 500 people on a regular basis sending information to Congress about what we feel is going on and what we want to have. And if we can get that many people together, and that would actually fall in line with what Patty was talking about, getting people together and doing a center of influence to get things rolling. So we could probably use the same people for the same issue. So we could double team this, couldn't we? Yeah. Mhm. So how does an organization like World Health Organization put together a stream of people that are doing their bidding?
Big money.
Big money. So is it a secret that when people died at the local hospital, they got federal money for the death? It's no secret. They did. They got federal money for diagnosing COVID. They got federal money for the death of a COVID victim. There was money that was passed out for doing that stuff. And I have friends that are in the health profession in this town, and they, when I'm talking about these issues, they basically look down in a way and act like they're not hearing what I'm saying. But deep down inside, they know what's going on. They do. But one friend of mine knocks down $100,000 a year. This person is the primary breadwinner in the household. This person spoke out twice. She had to hire an attorney to get her out of the second jam. The hospital did nothing to save the job. So when you're dealing with, like as an example, with people with World Health Organization, you've got the minions that work on the bottom end, being told what to do. They have no little idea of what the people in power are planning on. So their motives are different than the ones at the top. They're just trying to do good. Same thing applies to the people that work at the hospital, the nurses, the doctors, the anesthesiologists, the respiratory therapists. They're just trying to help their patients. There is no malice in what they're doing. They just don't know what the plan is. Does that make sense? Okay. In other words, it's supposed to help member governments expand into the role of healthcare provider for their citizens. Now, you remember that our Constitution allows us, well, actually that was the Declaration of Independence, allows us the pursuit of happiness. And the Constitution doesn't say anywhere that the government has to provide health care or cell phones or groceries or clothing. None of that stuff. We are allowed by our Creator to pursue happiness, whatever that takes the form of. So what we need to do is get on the mindset that we are in charge of ourselves, and getting back to how do we how do we do something like John said, you were close to passing legislation to where the Wyoming people would be able to basically,
We would ignore the World Health Organization.
just ignore them, nullify it.
It was 29 to 32.
Yeah, 29 to 32, that's pretty dang close. You might get it taken care of next legislative session. And I,
On the session. It would require a 2/3 introduction.
oh, yeah, because it's a budget session this next time. So it would take 2/3, so you probably wait till the next session then to try it. Yeah.
And we'll have to have it
What bill
on.
were you?
Freedom-minded legislators.
You gotta get it
The
right.
one about.
We'll have to have more freedom-minded legislators to get it passed.
Let's get it passed.
Yeah. The issue is, many legislators in Cheyenne feel that this will put our federal dollars at risk. They don't want to play chicken with the federal government.
Really?
So Taylor Haynes at one time had said, so what are we sending the money to Washington for? Why are we sending it there? Why don't we just keep it?
Oh, boy.
Well, and some smart aleck stood up and said, they'll subpoena us. The federal government will subpoena the state of Wyoming to a hearing. And then Taylor Haynes said, where is it in the Constitution that we have to answer a subpoena? It's not there. I don't think it is.
No.
Or is that bad play? Hmm?
No, I'm fully supportive of us not depending on federal dollars. Too many strings attached.
Yeah, too many strings attached, right.
Isn't that where they can hook the sheriffs too? So if the sheriffs take money from the government and say, you know, you got the IRS or any of those jerks coming here.
Yeah, the sheriff's
is he-
department's,
Is he hosed because he took federal money, so he's gotta adhere to what the feds say because they send him money, or can they tell him go, can he still tell him to pound sand?
I don't know the answer to
They're
that.
still the highest authority in the county.
Even if he gets federal aid?
Well, just like the state legislature. They don't want to give up those dollars. That's why they may turn and serve the federal government instead of us. So if he's willing to walk away from future federal dollars, then you've got a good sheriff and you can depend on him to protect you.
So,
But just taking those federal dollars doesn't take away his power and authority.
okay, so does he ask for the funds from the state? So does Campbell County Sheriff ask for funds from wherever they get the money from the feds? So the feds give it to the state gives it
A
to
lot of times.
the counties.
A lot of times it's that way. Sometimes nowadays, the feds will go, since COVID, the feds will go straight to, like, our school district, and they'll bypass our state legislature, which is illegal, but that's what they've done.
So who makes the decision if the sheriff takes money?
Ultimately,
The
it's
board
the
or the
sheriff.
sheriff?
Ultimately, it's the sheriff.
The sheriff.
But he can still make his decision on how he's gonna enforce the law, regardless of where he's taking money from.
Okay.
So that money may come with strings, and he may not get it in the future if he chooses to go against the will of the federal government. And that's the same issue with the state. They're afraid of losing federal dollars.
Okay, so why does he need federal dollars? Can't he get the dollars from the state? Is that why we pay taxes?
Let me have John answer that.
I really appreciate our sheriff, but I had to have a pretty frank conversation with him because he said that, we could raise more money if we just raised the fees on concealed carry permits. And I sat down with him and I said, this is the Second Amendment. We don't raise money and make a wall, if you will, to keep people from getting their Second Amendment rights. So properly, he would ask the state for more money just based on, we need to hire this particular type of detective, whatever. And he was very responsive, so I think he really does care about being a constitutional sheriff. But people have to be held accountable, and you have to remind them that they serve us, and that they need to be a constitutional sheriff. They really do have the highest authority in the county, because the federal government doesn't have a way to enforce laws. They don't have a police force. They rely on our sheriffs and our police.
So, for Campbell County, does the money, where does the money come? Does it come to the board or whatever, and then the board distributes
So
and has a budget?
the
saying-
majority of our money comes from coal, oil, and gas.
Okay,
Goes to the state.
Just a little bit.
The state sends it back to the county.
okay.
Okay? But a lot of those royalty payments are federal dollars because the feds own the majority of the mineral rights in the state of Wyoming. So they get the money and then they send some back to us.
Right, because okay. So, then does the city budget the amount of money that goes to the sheriff?
The sheriff's account.
So does the city budget, who in the city tells the sheriff, okay, you've got $2 million this year?
Okay, the sheriff is county.
Okay, it's county
County
commission.
commission.
Okay, that's what I want. And they have, when do they have their budget to go over and all that?
They're going over their budgets.
Right now.
Right
Yeah,
now,
the
I
county
know.
commission.
Yeah, I'm gonna give it to.
Yeah, that's commissioner.
I just wanted to point out that some of this money comes from federal grants. The sheriff can apply for federal grants like this stuff from a border that's out of control, and so you get an influx of drugs or something. They can apply for grants, which comes from the federal government money. And so then they're tied a little bit to obligate if they want any more.
Okay. We're running past, but I like this conversation that we're having because what you're getting into is we're talking about federal money and where does it come from? Taxes, but where does it come from?
It comes from the
It
states.
doesn't come from taxes anymore. We're in
Comes
such,
from me.
Oh,
folks, we're in deficit spending. They're printing this money.
they're
Yeah.
printing
It is
it.
not money.
Yeah. Thin air.
It is not money that we send.
10 years ago, taxes, income taxes generated 42% of what the federal government spent. It's much lower than that now. Like John said, they're printing money. So, getting back to this World Health Organization,
Funny money.
they get their hands on our medical services in the United States. It's not just going to be pandemics because you know nothing stops. It just keeps going. So we've got to decide where we want to go with all this. Do we want to get back to the way it was and we're making decisions ourselves? And where the federal government was put together so that we as individuals can make individual decisions on our own, and that our Constitution protects us from a tyrannical government, including the right to bear arms, the right to educate our children, to choose our health care or not to choose our health care. Do we want to just ignore our health and die? That's our decision. Wyoming ranks as the 6th most federally dependent state in new analysis. Wyoming, per capita.
Public service radio, so.
Oh, public service radio. Okay.
PBS, so you can
Uh-huh.
consider the source, so it's probably worse than that.
So, anyway, Ed wanted me to present this to you tonight because this has been on my mind. I happen to be in the insurance business. I got out of the health insurance business when Affordable Care Act came along. Because people, it's not, health insurance is no longer provided for us so that we can get medical care. And if you talk to data inputters that work for clinics and hospitals, and they've got these things called SIC numbers, SIC codes. And for every health procedure they do, they have to have a SIC code. They have to have that SIC code to provide to a health insurance company so that they can get paid. So what happens is the doctors are now saying, oh, let's see, what can we bill for? Not what the disorder is. So if we continue down this road with World Health Organization, with the CDC, with Federal Drug Administration, with all of this stuff, we're going to see our quality of life dissipate. It's going to happen. But we need to bring a lot of this stuff back to the states where we can make decisions on our own so we can live that independent, choice-making life that God gave us. Thank you.
Thank you, Lyle. Thank you so much. Lyle, you shared about the World Health Organization because it is a power grab. And so thank you, Commissioner McCreary, for being here tonight. If you have any questions for him, he's in the back. John Bear, Representative John Bear is here also. And thank you, I don't see any others in this room. And so with that, I will say thank you for coming, and remember our meeting second Monday, I didn't look it up, second Monday of next month will be our May Patriot meeting, and the weather will be nice, so y'all come. Thank you. God bless.